Let me ask you something personal. Has someone you love, your mom, your dad, a grandparent, ever gone into the hospital for one thing and come out worse than they went in? Maybe they went in for a routine procedure and suddenly they were confused, weak, or dealing with a whole new problem nobody warned you about. If that sounds familiar, you are not alone. And if it hasn't happened yet, what I'm about to share with you could be the most important thing you watch this year. Because here's the truth that doctors don't put on a brochure. Hospitals are not always the safest place for seniors. That's not me being dramatic. That's medical reality. The very environment designed to heal people can actually cause serious harm to older adults if they don't know what to watch out for. And the scariest part? Most families walk right into these traps without even realizing it until it's too late. Today, I'm going to walk you through 5 of the most dangerous hospital traps that seniors face. Traps that are completely avoidable once you know they exist. So, stay with me, because this could genuinely save your life or the life of someone you love. The first trap is one that almost nobody talks about, and it starts the moment a senior checks in. It's called hospital-acquired delirium, and it affects up to half of all hospitalized seniors. Delirium is not just confusion. It's a sudden, dramatic shift in mental state. The person seems lost, agitated. Sometimes they don't recognize where they are or who you are. Families often assume it's just the stress of being sick, or they think maybe their loved one has dementia. But here's what's actually happening. Hospitals are relentlessly loud and bright at all hours. Seniors get woken up in the middle of the night for blood draws and vital checks. They lose track of time. They can't sleep. They're on multiple medications that interact with each other. They're dehydrated. They're not moving. And their brain, which is already working a little harder to stay sharp than a younger brain, starts to short-circuit under all that pressure. Here's what you do about it. If your loved one is admitted, bring things from home. A familiar photo. Their own pillow if allowed. A clock they can see from the bed. Make sure they have their glasses and hearing aids with them at all times. Hospitals have a frustrating habit of misplacing these things, and a senior without their glasses or hearing aids is immediately more disoriented. Visit as much as you're allowed. Your familiar face and voice is genuinely medicine. Ask the nurses to keep a consistent schedule and to minimize unnecessary nighttime interruptions. And if you notice sudden confusion that wasn't there before, don't brush it off. Tell the medical team immediately and use the word delirium, because that word gets attention in a way that she seems a little confused does not. The second trap is quieter and sneaks up over days. It's called functional decline, and it happens when a senior stops moving during a hospital stay. Now, you might think, well, they're sick, of course they're resting. But here's the problem. For older adults, even just 2 or 3 days of lying in a hospital bed causes a level of muscle loss that would take weeks or months of physical therapy to recover from. And most seniors are in the hospital for far longer than 2 or 3 days. Hospitals are not designed to keep people moving. The default is bed rest. Nobody is going to come remind your loved one to get up and walk the hallway unless someone specifically asks for it. The IV pole, the catheter, the monitoring wires, all of it makes it easy to just stay in bed. And every hour they stay in bed, they get a little weaker. By the time they're discharged, they can no longer do things they could do when they came in. And now instead of going home, they're being sent to a rehab facility. And sometimes they never fully get back to where they were. What you need to do is be proactive from day one. Ask the care team if there are any mobility restrictions. If there aren't, ask for a physical therapy consultation immediately. Don't wait for someone to suggest it. Encourage your loved one to sit up in a chair instead of lying in bed whenever possible. Help them do small exercises with their feet and legs even while lying down. Walk with them in the hallway if the team clears it. Movement is not optional, it is medicine. The third trap is the one that surprises families the most because it sounds almost administrative. It's called the observation status trap, and it has ruined the finances of thousands of seniors and their families. Here's how it works. When a senior is admitted to a hospital, There are two very different statuses they can be placed under. One is called inpatient admission. The other is called observation status. From the outside, they look identical. Your loved one is in a hospital bed, wearing a hospital gown, getting hospital food, being cared for by hospital nurses. But legally and financially, these two statuses are completely different. If a senior is placed under observation status, Medicare treats their hospital stay as outpatient care, and this has devastating consequences. It means that when they're discharged to a skilled nursing facility for recovery, Medicare Part A, which covers nursing home care, will not pay for it. Because Medicare Part A only covers skilled nursing care after a qualifying inpatient hospital stay of at least 3 days. If your loved one was under observation the whole time, those days don't count, and skilled nursing care can cost thousands of dollars per day out of pocket. The hospital does not have to tell you this without being asked. Some do, some don't, so you have to ask. When your loved one is admitted, specifically ask the admissions team whether they are being admitted as an inpatient or placed under observation status. If it's observation status, ask why, and ask whether the attending physician can change it to inpatient admission. You can also request a review, and if they're ultimately discharged to a nursing facility, get your paperwork in order immediately and understand exactly what Medicare will and won't cover. The fourth trap is polypharmacy, and for seniors, this is one of the most genuinely dangerous things that can happen in a hospital setting. Polypharmacy just means being on too many medications at once, and hospitals are where this spirals out of control. Here's the scenario. A senior comes in on 8 medications they've been taking at home. The hospital adds a painkiller for their procedure, then an anti-nausea medication, then something to help them sleep because the hospital is so loud, then something to manage a side effect from one of those new medications. Within 48 hours, they're on 12 or 13 medications, many of which have never been combined in this particular person's body before. And older bodies process drugs differently than younger ones. The kidneys and liver slow down with age, which means drugs stay in the system longer and build up to higher levels. What's a normal dose for a 40-year-old can be too much for a 75-year-old. And when you're combining medications, some of which sedate, some of which affect blood pressure, some of which thin the blood, the interactions can be genuinely dangerous. What you need to do is bring a complete written list of every single medication, supplement, and vitamin your loved one takes at home, including doses. Give this to every doctor and nurse involved in their care. Ask the pharmacist on staff, every hospital has one, to review the full medication list for interactions. Ask whether every new medication added during the stay is truly necessary. And when your loved one is discharged, make sure someone goes through the discharge medication list with you line by line and explains what's new, what's the same, and what's been stopped. The fifth and final trap is one that breaks my heart every time I hear about it because it's so preventable. It's being discharged too soon and without a proper plan. Hospitals are under enormous pressure to move patients out quickly. Insurance companies push for shorter stays. Beds are needed for new patients. And so sometimes seniors get discharged before they're truly ready, and nobody puts together a real plan for what happens next. The senior goes home, and within days they're back in the emergency room. Studies show that nearly 1 in 5 Medicare patients is readmitted to the hospital within 30 days of discharge. 1 in 5. That's not a small number, and most of those readmissions are preventable with proper discharge planning and follow-up. Here is what you need to do before your loved one ever leaves that building. Ask for a meeting with the hospital's discharge planner or social worker. Ask what their recovery is going to realistically look like. Ask what warning signs to watch for at home, what the follow-up appointment schedule is, and who to call if something goes wrong. Make sure there's a plan for medication management, for any wound care that's needed, for transportation to follow-up visits. If they live alone, make sure someone is checking on them. And call the primary care doctor within a few days of discharge. Don't wait for the first scheduled appointment. Just call, give them an update, and make sure nothing is slipping through the cracks. So, let me bring this all home for you. 5 traps: delirium from sensory overload and sleep deprivation, functional decline from too much time in bed, the observation status billing trap that can cost tens of thousands of dollars, dangerous medication combinations that nobody is monitoring carefully enough, and premature discharge without a proper recovery plan. None of these are inevitable. None of them are just the way things go. Every single one of them can be avoided or at least dramatically reduced when you know what to look for and you advocate loudly and clearly for yourself or for the person you love. The hard truth is that the hospital system is busy and stretched thin, and there are more patients than there are people to carefully oversee every detail for every single one of them. That doesn't mean the doctors and nurses don't care. Most of them got into this work precisely because they do. It means that the system needs you to be an active participant. It needs a family member who asks questions, who stays informed, who speaks up when something doesn't feel right, and who doesn't assume that because something is happening in a hospital, it must automatically be the safest and best option. Your voice matters more than you know. A simple question, asked at the right moment, can change the course of someone's hospital stay. A family member who shows up consistently and pays attention can catch things that would otherwise be missed. You are not being difficult when you ask questions. You are being a protector. And for the senior in that bed, having someone in their corner who knows what to watch for makes all the difference in the world. Share this with the people in your life who need to hear it. Your parents, your siblings, your friends who are caring for aging loved ones. Because these traps are real. They're common, and most people have never heard of them. But now you have. And now you can do something about it. And if you want to keep learning how to protect the people you love, how to navigate health systems, age gracefully, and make smart decisions for long-term well-being, subscribe to this channel. We put out real, practical, honest information for seniors and the families who love them. Hit that subscribe button, turn on notifications so you never miss a video, and let's keep this conversation going together.